All right. Hi, I'm Dr. Ben Newman. I study coronaviruses and I read a lot of papers because of that. Let's try and answer your questions with that stuff, with science. So, next question is from Jessica. Yeah. All right. What do we got here? Let's see. If my household tests negative prior to visiting family, can we be sure that we are not bringing COVID to our relatives? Not sure, but you can be safer, and then you can still take some precautions while you're there. I would say. Um, to be sure, would you suggest that we test more than once? I mean, that's if we were going to send people onto the International Space Station, which I think we're still doing. Um, yeah, they would want to test definitely more than once. So, like, if I had contact with some schools in the northeast of the country, and they are routinely testing every staff member twice a week in some places and once a week in other places. Some places they're doing the same thing for any students who are actually on campus and doing anything face to face. Those are places where you have real low numbers of cases. Not zero, because everybody goes off campus at some point to go to the store or work out at the gym or whatever. Yeah, boyfriends, girlfriends, hanging out. Yeah, it happens. Life is there still. Um, so if you've had a negative test, it would also depend which kind. So if you're going for the rapid antigen test, I'm not as big a fan of that one. Those, just from the way the test works, have they need something like 1,000 times to 10,000 times as much virus to be there in order to give a positive. So they will only tell you if you have a raging case of COVID, and otherwise they'll say you're negative. And yeah, the negative on those doesn't really mean anything. It just means that you're negative on that test. It doesn't mean you don't have coronavirus in you. It doesn't mean you can't spread it to somebody else. And that is not what you're after, right? When you're visiting family, you're not looking to spread a contagion and put other people at risk. And so, yeah. But yeah, testing, and then between when the test comes in and when you're visiting, you would want, yeah, to have little or no contact with anything. And even then, I would say if there's a possibility to wear a mask or sit really far apart, or have any part where you have to be out, like eating outside and far apart, um, then that can work with like one person serving all the food and wearing a mask while they do it. Yeah, that could potentially minimize the amount of risk. I like that you're trying to do this. That's very good. That's the sort of idea that will help get us out of this gigantic hole that we've dug for ourselves. This part of Texas where I am is it's got a real surge. Yeah, we're having a terrible time right here. Texas and Arkansas. Yeah, Texarkana, twice as nice. All right. So yeah, thanks. And I think with the right precautions, yeah, you will be able to do this reasonably safely. And that's the point. The point is to figure out how do you do normal stuff, but in a safe way, so that we don't spread COVID, but still get to do most of the normal stuff. That is the challenge. It's not an impossible challenge. It can be done, and you're thinking through it in the right way. And so thank you for doing that. Yeah, so all the best, Jessica. And thanks very much. This has been Ask Dr. Ben.